Your patient has an IO for vascular access. Can you still use it even though you haven't taken the IO insertion class? Absolutely. We're going to cover special considerations in caring for and using an IO. Let's get started.
Brought to you by the Clinical Education Team.
Before using an IO, check for any signs of infection or infiltration of the extremity. Now, for infiltration, there's some special considerations with an IO. One is that you want to check underneath the extremity for any signs of infiltration, of swelling, things like that. Because what can happen is if they're laying supine, or especially if it's in the IO is in the leg, any fluid that is out, the infiltrated fluid can pull to the bottom or pull to gravity. So you want to check underneath the leg for that infiltrated fluid or swelling. The other thing that you want to consider with IOs is that the bone that you're going for is a lot deeper in the extremity versus a superficial vein that you're putting an IV in. So when you infiltrate an IV that's superficial, you see really quickly the swelling that occurs with that fluid, right? Because it's so close to the surface of the skin. The IO is different because it's deeper where the bone is. And so it's going to take a lot more fluid to actually see the surface of the skin, it to start to swell and things. And it may not be as obvious. Especially if the needle went through and through the bone, all that fluid can be infiltrating underneath the bone. So our suggestion is to get a measuring tape, right, from your clean supply room and measure the extremity immediately after insertion or before insertion to get a baseline of that extremity. That way, instead of trying to eyeball it later and be like, ooh, that looks a little big to me, you can just whip out that measuring tape, measure the circumference of the extremity, and you'll know right off the bat if you do have swelling of that extremity. Now there's some special considerations in regards to flushing an IO. Okay? When you flush an IO the very first time after insertion, or if you haven't used the IO in a while and you're flushing, there could be some resistance and also pain from the patient. This is because the IO needle is in the bone marrow, which is pretty dense. All right, they can't escape. It's in an enclosed area of the bone. All right, so as you flush, you are pushing out that bone marrow so that the fluid can go through and out of the bone into the circulatory system. Okay, this is why it's painful, can be painful for the patient, and also why we need to use an IV pump or pressure bag to administer IV fluids. Now, if they are in pain and they're responding to pain, then we need to ask the provider if we can use the lidocaine protocol for the patient. Now, the lidocaine protocol is found in the IO policy and procedures on the Banner intranet. Everything is laid out there for the lidocaine protocol. As you see in the policy and procedures, it has all the dosages in there for adult and for pediatrics as a reference for you. So some considerations with the lidocaine protocol is when you pull the lidocaine out of your Pyxis in the ED, be very careful that you're choosing the right lidocaine. Usually when you type in lidocaine, you have like 20 different options to choose from. So you want to pull the 2% preservative and epi-free lidocaine. All right, and you're going to slowly administer that for the full 2 minutes, a real 2 minutes. Okay, and then you're going to let the lidocaine dwell or sit in that IO and IO tubing for at least 1 minute prior to use, because we want to make sure that we're giving it time to work, right? And then you're going to flush with 5 to 10 cc's of normal saline for the adult and flush 2 to 5 cc's for the pediatric patient. So discontinuing an IO is completely different than discontinuing an IV, right? So how long can the patient have the IO in? Well, for adults it's up to 48 hours. For pediatrics it's up to 24 hours until you have to discontinue it and use something else or put a new IO in a different extremity. Okay, so how to discontinue the IO? First, you want to grab your supplies. So grab an empty 10 cc's or 20 cc syringe that can lock into the IO needle. First, you're going to remove the extension tubing and then you're going to remove the transparent dressing or covering for the IO. Once you tighten that on, this is going to provide you a better grip to get a hold of the IO needle to take it out. It's really hard to get a good grip on the IO needle without attaching an empty syringe to it. Okay? So, and then when you pull the syringe out, you're going to pull straight out. You don't want to bend it at all. Bending it can make it even harder to get out, but also the needle can actually break inside the person, which is something that we definitely don't want to happen. Okay? So as you're pulling out straight, you're going to turn in a clockwise motion. Okay, the reason why we're turning in a clockwise motion is because if you do a counterclockwise, you're going to accidentally loosen or completely unscrew that syringe to the IO needle, and then you're pulling full force that IO needle, and that suddenly comes off. You can hurt yourself or hurt someone around you. So that's why you want to do clockwise as you pull. Okay, now sometimes some are easier than others to discontinue. So just be due diligent and continue to twist clockwise as you pull straight out. If you haven't taken out an IO before, we highly recommend that you do this with someone who has experience and knows how to do it. That way they can walk you through it and troubleshoot along the way. Thank you so much for watching the video, you guys. If you have any questions, we have a ED educator group email listed below there on the screen. And then there's also a 1-800 number on the EZIO packaging that to the manufacturer that's open 24/7 in case there is any troubleshooting or issues along the way, especially on night shift where you don't have a lot of resources available for you. Please finish the quiz after this video to get credit, and thank you guys so much. You guys have a great day.